Well, it's seeing the outcomes of our patients, and it's seeing other professionals resonate with the idea and get excited about transforming healthcare and health outcomes. So, silly little story, at the end of every open source wellness gathering, we do gratitudes, offers and requests, and declarations. So participants get to say what they're grateful for, what kind of support they need, and what kind of support they can offer each other. So we're sort of building community. And declarations is where they name what it is they're committed to for the coming week. And declarations are often about nutrition or exercise or stress reduction. But recently, we've started to hear declarations like, I'm going to floss my teeth every day, or I'm going to handle my credit card debt. And at first, my team and I, we were kind of perplexed. We were like, we've never talked about dental health. We've never talked about financial well-being. But what we came to understand is that when our participants start to get some traction, they start to have some early wins, right? They have some success in making and meeting goals that matter to them. There's a phenomenon of activation that happens, and they start using the same sort of human technologies of change to apply to other things in their lives, like their finances, their relationships, their homes, etc. And that's what makes it worthwhile to me, that I care about health, and even more than that, I care about human thriving. So just seeing those wins and those experiences of our participants taking on their own lives and creating transformation, and do this forever. So I envision a world in which both clinical systems and social systems potentiate human well-being as the default rather than as the exception. So to sort of bring that to life briefly, imagine, a woman with several children, she's maybe working 2 jobs. At the end of her day, working long hours, she comes home, she picks up her kids, and then she's supposed to shop for produce, prepare it, feed the kids, clean up, help them with homework, handle all their needs, and then she's supposed to go to the gym, meditate, and see her friends. Like, give me a break. Most of us can't pull this off, never mind those who lack the privilege to access all the boutique services that help make it possible. So I envision not only a clinical system, but a social system where our fundamental needs are built into the groundwater. And you don't have to be either a rock star or wildly privileged in order to lead a happy and healthy and well life. So I'm a little bit of a renegade at this convening because I believe in and use technology, but I don't know that it is solely the answer. Because at the end of the day, people have to move their own honest-to-God bodies, they have to eat honest-to-God food, and I think that if technology helps us do those behaviors, great. And I think that we can often intervene in a way that's more direct, that we can use economies of scale and we can use the power of community and social support to actually facilitate the behaviors we're seeking in a way that's fun, that's easy, that's accessible, that's democratized, rather than looping through technology to try to inspire people to do it on their own in a way that's fundamentally upstream from our culture. So yes to technology, and even more, yes to the use of intentional community to make healthy living the default rather than the exception.